in Canada, it's funny, one of the patients brought up today, "Hey, doc, it's probably joking, but he says, do you think tariffs affect people's teeth? Does their teeth get messed up with tariffs?" And we started laughing. He was joking around. I said, it might. Welcome back, everybody, to our channel here. Bob's your dentist, Heartland Dental Centre in lovely Mississauga, Ontario. It's a nice day. The birds were chirping. I saw a cardinal. It's always a good sign. It means summer's around the corner, so we're excited about it. Being in Canada, it's funny, one of the patients brought up today, "Hey, doc, it's probably joking, but he says, do you think tariffs affect people's teeth? Does their teeth get messed up with tariffs?" And we started laughing. He was joking around. I said, it might. And he was like, "What do you mean?" And I said, you got to think of it this way. When you are anxious about anything, whether it's tariffs or anything else, your breathing changes. The rate of your breathing changes. And the rate of your breathing could affect the tendency toward acidity in your blood. And what makes your saliva? Well, your saliva comes from blood. It's a form of refined blood. And guess what? If your teeth and gums are sitting in an acid, what's going to happen over time? It's going to soften the teeth, soften the gums, create recession, bleeding gums, cavities, and worse. So yeah, maybe in a certain degree, the tariffs may be affecting your teeth. On that level as well, talking about saliva. We swallow our saliva. Saliva goes down into your esophagus, into your stomach. It can also go down into your windpipe, towards your lungs. Now, imagine you don't take care of yourself and you have high population of bad bacteria in your mouth. What's going to happen? It's not going to be good for your lungs, I can tell you that. At least if it's going in the stomach, you got stomach acid, there's a chance. But in your lungs, it ain't good. And that leads to the other thing. Unfortunately, one of our patients today, I just had found out, had gotten a double lung transplant. It's a big deal. And it's unfortunate they had to go through it, but it's fortunate that it happened because he needed it. But what I found very interesting was the letter that I received from his doctor with him. It's one of the first times I've seen this. I'm quite impressed. But what it says here is, lung transplant recipients are encouraged to maintain good dental hygiene through routine follow-up with their dentists. Lung transplant recipients, although at increased risk for some infections, have been shown to have no increased risk of infective complications following dental procedures. So they are starting to, or do understand, that there is a profound connection between even the mouth and the lungs. So again, another reminder, try to understand there's no borders, there's no walls between, nobody's building walls between the mouth and the heart and the brain and the lungs. This is all one piece. And the sooner we put the puzzle together, the clearer we can see the picture. So until next time, Bob's your dentist.